Hi guys, Dr. Joe Brown. So I want to go over a little bit of which scans to get and which scans to use and why to use them. Whether you've been diagnosed with cancer or whether you've just been to the doctor or whether you have a pain or an illness or a problem somewhere, you've probably been to the doctor, probably got different blood works done, which we've covered in a lot of our different videos. But let's talk about scans and which ones to use and what times to use them, okay? Because we have a list of different types of scans. And we have things like ultrasounds, we have general x-rays, CT scans, MRIs, PET scans. So why do we use them? What's the differences? Which ones do you get radiation from? Which ones do you not get radiation from? Let's just go over this topic for a second. So first, ultrasounds. Why do you use ultrasounds? Ultrasound is something that bounces wavelengths of energy off of different organs within your body. Okay, it's the easiest way to describe it. And the reason why you use ultrasounds is if you're measuring your gallbladder or checking your gallbladder, checking your liver. Maybe you're pregnant and you need to do an ultrasound for the baby. These are the reasons why we use ultrasounds. Ultrasounds have no radiation. They're essentially just using a radio frequency, bouncing these waves off of structures, which then give us a computer-generated image for us to look at as physicians. Okay? Next one, x-rays. Everyone's heard of x-rays. They've been around forever. X-rays, you do get radiation from. Okay? And we use them in dental offices, to chest x-rays, to x-rays of you possibly broke your finger, arm, leg, something of this nature. You do get a small amount of radiation from x-rays, but you also get radiation when you're sitting in front of the TV screen, when you're flying on the airplane as well. So you need to put correlation into, do I need to get the x-ray done? How many x-rays are you going to have? And what is the end result when you're doing scans? And I'm not just referring to x-rays, but I'm referring to these other scans we're going to talk about as well. Because a lot of people contact us and they say, well, Dr. Joe, I don't really want to get this scan because I don't want my body exposed to excess radiation or excess exposure to things if I don't need to. I don't want my cancer to spread. I don't want to get excess radiation from things if I don't need to be doing it. Well, in some aspect, I agree with you because I don't want to put you or any patient to excess exposure if you don't need to. But these scans are vital to tell us what may be going on so we can get to the diagnosis and we can treat you properly so that you get well. Okay? Next one is CT scans. Now, when you go in for a CT scan, what is a CT scan? It's essentially you lay down in a cylindrical type of machine. You lay down on the bed, which then puts you back into this donut-shaped plastic Honeywell usually or GE moderated machine. And what it's doing is this is also going to expose you to a certain amount of radiation. But the computer-generated image that we are getting from this is so specific, especially if you do a CT scan with and without contrast. This can decipher what is tumor, what is bone, what is soft tissue, and anything else that could be there. Okay, very, very useful type of scan for many, many different conditions. Okay, the reason why we use CT scans could be anything from cancer to bone conditions, any type of hard structure type of images. CT scans are also very vital in if we think something's going on in your gut. This picks up stuff in your gut very, very well. Okay. Fourth one, MRIs. MRIs you get no radiation from. MRIs is a magnetic resonance imaging. That's what it stands for. And it's essentially just using a magnet that goes around. And if you've ever been in one, again, this is a donut-shaped type of computerized imaging system that when the magnet is circling around your body, if you've ever been in one, and I've been in them quite a few times way back when I had cancer, so I very much know what this is like. It's very annoying. What happens is when this magnet's going around, it's making what sounds like a very hard ticking sound. And the reason why it's doing that is that when that magnet is going around, it is bouncing magnetic resonant imaging rays off of your body tissues. And MRIs are also used in cancer and also used in soft tissue type of areas. So if you want something from an aspect of identifying something that could be soft tissue, we often use MRIs. Okay. Last one is the PET scan. PET scans are using a radioactive isotope. And so a lot of people have contacted me saying, well, why would I inject something that's radioactive into my body? You have to understand that you're injecting a radioactive half-life isotope into your veins, and it lasts within your body usually for somewhere around 30 seconds to a few minutes or so, and it's already dying off. Okay, and that's where the half-life comes in. And the reason why we do this is because using that isotope is centered in around areas where we have tumor. We're usually using this in cancer cases. And by using that, it gives us a very, very clear image of tumor in comparison to regular body tissue. So I hope that helped. I just wanted to go over some of the top 5 most common scans, why we use them, and when we use them. So again, any questions from me? Contact us right below. Remember, your health is in your hands.